So why disease occurs? According to our electrohomeopathy, there is a disequilibrium in lymph and blood. We know that. But to strong the lymph and blood, we need food, diet. Okay. So at last, after giving treatment, the treatment also we are focusing on lymph and blood, removing the symptoms, number one stage, removing the disease, and after removing the disease, improving the organ health. Okay. And last, the lymph and blood. So these are the uh, four stages of our treatment plan. So in that, we need to advise diet also to the patient. Okay. So diet is very important because after giving treatment, okay, again, if the patient lives the same life what he past lived, so again he will become sick. Okay. So we have to advise the patient to need to change their lifestyle. If they doesn't change their lifestyle, so they will have again that problem. Okay. So this is the basic thing we need to remember during the treatment. So that's the reason we are studying food and nutrition to advise the patient. So we are studying B complex vitamins. Okay, in that most of the four vitamins are completed. Today we are going to talk about remaining four B complex vitamins. The another B complex vitamin is pantothenic acid. Pantothenic acid. It is B complex member. Okay. What type of function it will do? It is required for biosynthesis of corticosteroids. Biosynthesis of corticosteroids. All the steroids in the body are made with fat. Okay. So we need pantothenic acid to convert and to utilize this fat as a hormone or steroidal. Steroid is a hormone. Hormone is made up of fat. So here this vitamin is doing a function, okay, to convert those hormones. In the presence of pantothenic acid, only this function is happening. And another function of pantothenic acid is to cure skin diseases also. It is also helpful in skin diseases. Skin diseases. So like mostly in dermatitis, inflammation of skin. Okay. So basically, this is the important vitamin B complex. So what is the source? This is the function we discussed. Now source is liver. Liver having actually liver having large amount of B complex. Every vitamin is present in liver. Okay, wheat gram, rice, rice also having without polished rice having all the vitamin B complex. Mostly cereals, legumes, nuts, and seeds, eggs. Okay. And the another thing I want to discuss you that in the older days, like in mostly in Unani, there is a quote that which organ is affected. Okay, like example, if any one kidneys are affected, so in the olden days the hakim will tell the patient to eat kidneys of the animal. Okay, so nowadays also some hakims advise to the patient to improve the function of kidneys. How much it works we don't know, but likewise, but in the liver we know that there are the multiple B complex vitamins are present in the liver. Okay, this is the thing, and this is the sources. If what happen if this is how much amount we need. Okay, in infants we need 1.5 to 2.5 milligrams per day. Infants, in children we need 5 to 8 milligram per day. Okay, in adults 8 to 10 grams per day. Pregnant or lactating women 10 to 15 milligrams per day. So this is the normal recommended daily allowance. Okay, in the body, maximum to 18 to 35 milligrams are accepted, and more than that, the body will release in the form of urine. Okay, so this is about the uh, pantothenic acid, and what will happen if the deficiency will happen. Mostly, this deficiency is rare because whatever we are eating, like we will eat rice, we will eat take eggs. Whatever we are eating, pantothenic acid is present mostly. So what will happen if the deficiency occurs is tremors, mm, nausea, vomiting. Okay, but is rare. You can avoidable these things. Next important or very important, not important, very important B complex, that is folic acid. Folic acid. We know that the doctor advised to eat folic acid in anemia. Okay, so why? Let's study that. Folic acid is a folate is a, actually its name is folate. It is a Latin word, means leaf. Folate means leaf. Folic acid, an alternate name for folate. Okay, but is discovered in 1946. Okay, discovered in 1946. Okay, how much amount required? Mostly in pregnancy, it requires large because to development of the fetus. Okay, so how much amount we need? We need adults 100 microgram per day, and pregnancy 500 microgram. 500 microgram, very important. Children 100 microgram, and in the lactation period 300 microgram. But is very important. So mostly in pregnancy, you need not double, triple. It is more than 4 times. Okay, so this is very important. Multivitamin, which is required for all of us, but in the pregnancy, then no more than 4 times. What is the function? Very important function. So when the production of RBC is happening in the bone marrow, okay, so RBC need to mature. So to maturation, we need folic acid. Okay, to produce to this is RBC. A matured RBC will after maturation only it will go into the bloodstream from the bone marrow. But if it is unmatured, what will happen? The RBC will destroy, will become very fragile, unable to carry oxygen, because in the RBC we have hemoglobin, iron, plus oxygen. Everything is there. So RBC need maturation. Maturation is happen due to the presence of folic acid. This is the important function. Next important function of folic acid is for DNA synthesis. Very, very important. DNA synthesis. Without DNA, nothing cell will work. Okay. So whenever cell division happens, so what will happen? Need to uh, divide the DNA also, replicates the DNA molecules also. Okay. So this is very important. So these are the two functions. Other than other functions also are there, but they are the two important, very not important, very very important functions. If RBC is fragile, what will happen? You can see that anemia patients. Okay, they need to take blood transformation. Okay, due to the damage of RBC. Okay, so this is very very important. Without blood, the patient cannot survive. The person cannot survive. We need blood. So need uh, the life of RBC is 120 days. So another after 120 days you need more RBC. So every time you need follicles, folic acid to mature the RBC. So if there is amount is less, what will happen? The RBC will immature and you will have numerous problems in the body. So there is a reason in the pregnancy, doctor advised folic acid, sources of food, and sometimes they advise to take the supplements also. Okay, deficiency. What will happen? Deficiency will leads to anemia. Okay, and mostly in pregnancy, what will happen? This will occurs megaloblastic anemia, like weakness, pallor, gastrointestinal disorders, sometimes infertility, severe deficiencies, sterility, abortions, congenital malformations. So that is the reason vitamin B12 is very, very important. So sources, very you will get numerous sources. One is leafy vegetables, liver, meat, eggs, dairy products, fruits, cereals, okay, and idli, dokla, dosa, and our intestinal bacteria, good bacteria, okay, that also produce folic acids. So this is about folic acid. So very, very important. So other vitamin B12, very, very important. That is vitamin B12. What is the another name of vitamin B12? That is cyanocobalamine. Cyna, cyanocobalamine. Very important. It is discovered in 1948, first thing. Okay. And it have cobalt atom. So that's the reason we'll call cyanocobalamine. Okay. So basically, you need to understand this absorption. Very important. When you are taking the cyanocobalamine, okay, in the stomach we have intrinsic factor, okay, because we have numerous enzymes, HCl. What will happen? It will break down the carbohydrates, proteins, fats, everything. So after that, if you take any fruit or anything which contains cyanocobalamine, What will happen? There is an intrinsic factor in the stomach. It will protect it. It will cannot, or the stomach will leads to break down it. So intrinsic factor will protect it and take to the small intestine. The small intestine then absorb it. Okay, this is the important thing. So intrinsic factor, mostly it explained in the digestive system, anatomy and physiology. Okay, so after that absorption happen, and kinocobalamin, it is in inactive form, it is converted and to active form, then it is stored in the liver, not completely stored, some amount is stored. So after that, according to the requirement, it will release into the blood. Okay, this is the important thing. So how much amount we need? Infants and children's 0.2 microgram per day. Adults 1 microgram per day. Pregnancy, lactation 1.5 microgram per day. Okay, these are the recommended daily allowance. Next is food. Which food have more vitamin B12? Liver. Liver having very rich amount of vitamin B12. Meat. Next, fish. All the non-veg, mostly eggs, dairy products. Okay, milk, everything. So this having very rich amount of, this five foods having rich amount of, liver having more than normal, 120 to 130 microgram per 100 grams. If you take liver 100 grams, what will happen? You will get 120 to 130 microgram. Okay, so this is very important. So vegetables doesn't have this vitamin B12. So this is one negative thing. We have to know about that. Next function. What is the function? Why it is important? In the vitamin B12, vitamin B complex, vitamin B12 and folic acid, very, very important. Again, it is function to mature the RBC, mature RBC. So not only folic acid, RBC also need vitamin B12. Not only vitamin B12, white blood cells needs RBC, not only RBC, WBC and platelet cells also need vitamin B12 for maturation. And third is DNA formation. Fourth one is we have nerve cells. See, very important. Nerve cells in the nerves axon. We have myelin sheath, which is made up of fatty acids. So for synthesizing this myelin sheath, you need vitamin B12. So vitamin B12 deficiency leads to neurological disorders. So these are the four long, big, important, very, very important function of vitamin B12. Now the deficiency, what will happen? So mostly it leads to very strict disorders. Whoever having this deficiency leads to anemia, skin disorders, tongue disorders, neurological issues, and many more. Okay. So in that condition, we need to take treatment orally or sometime injections. Okay. Mostly vegetarians who are strictly vegetarians, they will lead to these types of problems. Okay. Nerve degeneration will happen. So this is about vitamin B12. Now, last vitamin, that is vitamin biotin. Now it is very common. You're seeing the advertisement of biotin for hair fall, hair fall, hair fall. Okay. So let's see what biotin is do. Mostly biotin deficiency does not occur. Okay. Mostly. Sometimes it will happen. Why it is important? Biotin is important for enzyme production. Why it is important? Enzyme production. Okay. Biotin deficiency. What will happen? Biotin deficiency. So why it is important for enzyme production? So in the stomach, we need enzymes to digest. In the small intestine, we need enzymes for digestions. Okay, so enzymes are very important. So what they are doing, they are providing enzymes to digest the food. Digestion will happen properly, absorption will happen properly. Absorption will happen properly, then metabolism will happen properly. Then metabolism will happen properly, then cell will get required amount of energy. So why are providing biotin in hair fall? Basically, nutritional deficiency is happening in the body. So that's the reason there is a hair fall. So it works as enzyme. Okay. So what will happen? So mostly a deficiency will or a deficiency occurs. What will happen? Depression, hallucination, muscle pain, localized paresthesia, anorexia, because it is very important for generating absorption, anything, metabolism, alopecia. Here the alopecia, hair fall, scaly dermatitis, okay, and sometimes hepatic. So here one investigation is telling that whoever eat large amount of raw eggs, not boiled eggs, raw eggs will leads to biotin deficiency because the biotin will not absorb when you take raw eggs, okay, because it have a protein which leads to block the absorption of biotin in the intestine. So minimum, uh, that is one extra thing. Mostly not only eggs, also excessive alcohol and sulfonamide therapy also increase the risk of deficiencies. Okay. So how much amount you need to take biotin? How much amount? You need to take 25 microgram per day. In initially, the ICMR told this, but now 30 microgram because of our daily activities nowadays. You need 30 microgram. After 2020, this advice is taken. Okay. So for infants, 4 to 5 micrograms. For adults, 25 to 30 micrograms per day. It is required. Sources. What are the sources? You need the taken from liver. Liver is very everything. In your liver, you have everything. Okay, milk products, egg yolk. So nowadays, everyone is telling that no, don't take egg yolk, egg yolk, egg yolk. But it present vitamin biotin is present in egg yolk. Cereals, so everything is not correct, which are telling in the reels or reels. So you have to understood that. Next, uh, mm, okay, that legumes, nuts. You have nuts, legumes, everything, seeds. Okay, everything have biotin. If you take biotin, then what will happen? You have bacteria also which can produce biotin also. Most of the biotin content is in khova. You need to try khova. Okay, you have khova, paneer. Okay, and egg, mushroom. These are the having very high amount of source of biotin. Okay, so this is of vitamin B12. So very very important. We need vitamin B complex to help our body to do its normal function. It is associated with us. It needs for normal functioning of the body. So we completed vitamin B complex. Every vitamin is very necessary for our body, which is very essential. Okay, and also we'll call as water soluble. So this is about vitamins. So we completed carbohydrates, proteins, fat, and vitamins. In coming class, we will discuss about minerals. Okay, in detail. On Monday, we will discuss about minerals. Anyone have any doubts? Kindly ask.